Thank you, sir. I cordially invite Dr. Amal Harsha De Silva, Additional Secretary to the Ministry of Health, to address the gathering now.
Madam Robin Modi, Excellency the Ambassador for Australia and Sri Lanka, Dr. Anil Jasingha, the Director, National Hospital of Sri Lanka, all the distinguished members in this audience, including Kitsarit Singh and his team, and the guests, my friends from US, Lena Ransing and the whole team here. It's a wonderful moment as far as Sri Lanka is concerned. Today, we are going from strength to strength as far as healthcare is concerned on a day-to-day basis. Now, talking about IIHS, I think they have done enormous thing, a change in how we look at healthcare in this country. Now, they have started from humble beginnings, as Dr. Lena Ransingha quite rightly said, but with a very warm and a good heart. And I think it's nice to see that it's bearing fruit. Now, there are a lot of changes that have happened to grassroots level people's lives. About 200 people have changed their lives completely because of this institution, and they have got gainful employment elsewhere. I can remember when they just started, they said it's a very benevolent thing. We don't want to see Sri Lankans as housemates slaving away in the Middle East, and that's how they started this. And I think you have achieved a lot, and I think you can be justifiably proud of what you have done. And this Bioinquirer is another step that you have taken, and that step also has promising results, because I think the able support of the Australian government. I must tell you, madam, you have done an enormous amount in this country, and we really respect you for what you have done. And I think your Prime Minister, Mr. Tony Abbott, he also came here, and he also gave us a lot of encouragement, which is a rarity in the present day. And I think all these things, our strengths, should be put together to develop this country, to make ourselves stronger, and also to do what we do today a little bit better tomorrow. And trauma care, when it comes to trauma care, this institution is one of the most wonderful institutions which are given trauma care and which can give lessons to the whole world, I must tell you. And the most able director who was handling the emergencies for the last few decades are here with us. That is Dr. Anil Jasingha. He has done enormous amount of work as far as the trauma is concerned. We had a very bad period, as you all know, for the last 30 years. There are many casualties which came to our institution without any notice sometimes. And of course, we manage many of them with a very exemplary track record of management. I think therefore, it's very pertinent that you selected the National Hospital of Sri Lanka to have this very, very important and a vibrant conference. Now, when it comes to trauma and emergency care, it's a success story at the National Hospital, under the National Hospital roof. It's not the same when it comes to outside the country. We have to develop ourselves and educate ourselves at the grassroots levels to improve care, improve the golden hour of treatment. I think I'm subject to correction by all the senior surgeons like Dr. Ramani and all the experts who have come from US. But still, I think we have a long way to go as far as the improvements are concerned. Therefore, it's continuous quality improvement, the Japanese Kaizen approach, that we would like to have. And therefore, I think we have a lot of powerful allies today. The Australian government is helping us in a big way, and the US is not. And US government is helping. I think these are part of the US citizens are here, and it's a wonderful country. I was just there 1 week ago, and it's a superb country to be. And in the meantime, Malaysia is very, very strong. Malaysia is helping, and also UK have been helping. And I think you have gathered a lot of momentum in trying to do what we do at the grassroots level on a day-to-day basis, a little bit better. Now, I must say that these things don't happen by itself. there should be some big commitment behind all these things. And I see this commitment of Dr. Kitsile Singha and a world-renowned scientist, I must say, Dr. Harsha De Silva. I think you have done this change, and I hope that this change will bear fruit at the grassroots level people, and the people's life will change in time to come for this country, and the results of this conference will benefit large amounts of caregivers and also care recipients in time to come. And therefore, let me wish this conference all the best, and the Ministry of Health is there to support you, and our Excellency the President, Mahinda Rajapaksa, wants to make this the hub for healthcare in time to come. And we are coming there. We are a country who have maintained very good health at low cost. Quantities of care we have achieved, we have mastered. But individual high cost interventions, emergency care, trauma care, we have to improve. And therefore, I think these are the gap filling area, and we want to learn from the world and also share the knowledge with the world, and make this a vibrant place in healthcare in time to come. And I would like to thank you for organizing this conference here, and also once again, thank you, Robin Modi, Madam, for organizing this and helping us. You are the first government to come and help Sri Lanka when we were just out of trouble. And I really remember that with all the gratitude. Thank you very much.